Hello, this is Dr. Emre Karadeniz, plastic surgeon practicing hair transplant surgery exclusively for the last 15 years. And today I want to talk about surgical hair cloning. So let's look into the background of this first. The biggest challenge in hair transplant surgery is the limitation of donor hair resources in advanced hair loss cases. So everybody's looking for more hair, but there is only a limited donor supply. And if you ever try to take too many hairs from the donor area, then the donor area becomes depleted and it looks moth-eaten. So is there a way that we could actually get more hairs while preserving the aesthetics of the donor area? And the answer to that could be surgical hair cloning. So what is surgical hair cloning? So this is different than the actual cloning where, you just clone an individual or clone an organ in a laboratory setting. Okay, so this is a surgical application. Okay, so this is not exactly the same as cloning in, let's say, cloning a sheep. In this case, we're doing a surgical procedure hoping to increase the number of hairs. And perhaps another definition to that could be hair multiplication. And in this procedure, we are essentially trying to take a piece of the hair follicle, hoping that that piece will grow at the recipient site and the remaining piece will grow at the donor area. So if this is possible, then we would be practically cloning or multiplying the hair because the number of hairs would increase. And obviously this would be an excellent thing to achieve. In 2014, I had a patient which I did a restoration at the temporal peak area. As some of you may know, the temporal peak area contains of finer hairs and mostly hairs with only single units. So I did a temporal peak restoration on a patient using only single hairs. And the patient came in a year later, and to my surprise, most of the units contained 3 hairs. So they were like thicker and pluggier than they actually should be. I actually had to go in and remove some of those hairs. So I thought about why that could have happened because I was positive that all of the hairs I transplanted were single hairs. So I went back to the procedure and thought about what had happened. In FUE procedures, we use a punch excision technique, and that technique provides us with follicular units or grafts with a variety of number of hairs per graft, like single, double, triple, or more. Most of the single-haired units in FUE do not come from single follicular units because in FUE the tendency of the surgeon is to remove units with as many hairs as possible, and this is understandable because we want the least amount of scarring and the most amount of hairs. So we almost never remove the single hair units. So the single hair units that we find in FUE procedures are mostly from partially transected follicles. A transection is when the hair is cut in half at obviously different levels. So a part of the hair is left behind at the donor and a part is inside the graft. A total transection would be all the hairs transected within that unit. If that happens, scientific studies shows that there's little to no chance that this graft will actually grow mature hair because it doesn't have any hair follicles intact. A partial transection is, however, some of these hair follicles being intact and some of these being partially transected. So single hair units in FUE are mostly from partially transected units. So let's say that contains 1 hair intact, but 1 or 2 hairs transected at the top. Normally, hairs transected at the top, because they don't have their roots, they're not expected to grow mature hair. So we assume these units as single haired units. But because of the principle of surgical hair cloning, it turns out that some of these partially transected hairs actually grow mature hairs. This is what I thought. So in 2015, I decided to do an experiment on a patient that agreed to do it. So there was the patient who had advanced hair loss. So this patient was going to have 2 hair transplants separately, one for the frontal half and one a year or 2 later to cover the crown. So I could do a small experiment at the crown region. So what I did is I transplanted in a box 30 grafts with single hair units containing partial transections of 2 hairs each. So they have 1 hair intact but 2 hairs cut from the top half. And in another box that I took as a control group, I transplanted only single haired units. So these had singles with no transections beside them. So even if they had these partially transected hairs, I would surgically remove them, leaving just a single intact unit. And a year later, I checked up on these 2 boxes. Normally, I'm expected to see 30 mature hairs in each box because there are 30 intact hairs in each of the boxes. But in the box where I put the partial transections, I counted 60 hairs or even more. So the hair number had been multiplied by 2 because of these partial transections. So this practically meant that actually had done hair cloning because the roots left at the donor area, which obviously wasn't observed in the study, probably grew as normally because their roots were left there. But the cut tops also grew at the recipient area, which is why I think this method deserves to be called surgical hair cloning. And on the other box, where I used as the control group, I was expecting 30 hairs. There were less than 30 hairs. So this also suggested that when partial transections are totally removed, this affects the graft in a negative way and reduces its survival. So how should surgical hair cloning be used? So as I said, this is causing partial transections carefully, deliberately. So traditionally, transections were something that we tried to avoid as much as possible. Oh, let me remind you here. So if we do not cause any transections, let's say 0 transections, what would happen is a 3-haired unit would be moved as a 3-hair unit and would grow 3 hairs at the recipient site. But those 3 hairs would be lost from the donor area. So the total number of hairs would not decrease, but would not increase either. My suggestion is that if we have a controlled way of causing transections deliberately, we could actually clone the hairs, increase the number of hairs transferred in one session while preserving the aesthetics of the donor area, because in the remaining punch holes, it is expected that part of the units will grow. So there will be 1 or 2 hairs growing out of the punch holes, which will improve the aesthetic outcome of the donor area significantly. So how should surgical hair cloning work? Okay, so the first thing in order to achieve this is we should have a controlled transection rate. And in my experience, this controlled transection rate should not be less than 20%, but should be perhaps between 20-25 or at most 30%. If it exceeds 30%, chances are there will be a significant amount of total transections, which could cause poor growth. So we want to control the transection rate about 20-25%. So we're doing a lot of grafts. We must use a smaller punch than usual. So we're going to create much smaller punch holes that will heal very quickly within a few days and become invisible. So we would achieve skinnier grafts from this punch. But because these grafts are skinnier, we need to transplant them quickly, and also we need to preserve them in a holding solution before they are transplanted, because these grafts will tend to dry out and lose their vitality quicker than the traditional chubbier grafts. So for that reason, we are using a heart, liver, kidney holding solution where the tissue can stay and survive and get its nutrition until they are transplanted. So basically, we need an extremely well surgical team. We need to use a very small punch, and we need to preserve the grafts in a holding solution and make sure they're not dried and transplanted back as soon as possible. So this is basically how I perform surgical hair cloning or multiplication. So lastly, let's look at who is most suitable for surgical hair cloning. The number one reason, obviously, to consider this is advanced hair loss. So I'm talking about cases where multiple hair transplant sessions would be required to get good coverage, like 3, 4, 5 hair transplants. The other reason could be people with perhaps not so severe hair loss, but wanting smaller punch holes so that their donor area heals very quickly. The other reason would be, let's say, moderate hair loss. Let's say we're talking about a hairline restoration procedure where we don't need a huge amount of grafts, but we would have rather had those skinny grafts from the hair cloning so we can densely pack them more, because 3 or 4 haired units are extremely chubby in nature and they have to be spaced significantly apart. But let's say 2 haired grafts can be much skinnier and densely packed more, and the eventual density sometimes with the 2 haired grafts can be much denser than where you transplant the 4 hair grafts. The other reason could be skinnier, and grafts with less hairs per graft tend to blend in and comb more naturally than a pluggier look where you have 3, 4 haired units. So perhaps more densely packed transplant containing less hairs per graft can give more natural results than multi-haired units that are spaced apart. But obviously, I would think that the most important reason is advanced hair loss, and probably most important of all is practical decisions, like people wanting to really get it now rather than spread the restoration journey into many years. Some patients don't sympathize much with the idea that hair transplant surgery is a journey and it will go on for 10, 20 years. Some people just want to get what they can get now and accept whatever's going to happen to them in the very long term. Simply they don't care, let's say, about their hairs when they have grandchildren, and I understand that. So you can see it as a time perspective. Some people just want it now, and also cost. So some people just have a budget for now and they want to just do it very quickly within 1 to 2 years. So let's not forget it. When you do surgical hair cloning, you are doing a lot of punches in one visit, and therefore you're using maybe 60% of the donor capacity or 70% of the donor capacity in one hair transplant session. So for people who want to, let's say, have a hair transplant journey for many years, have decent sized sessions over 10, 20 years, this may not be the method for them. But for people who really want it now and want a significant result now in 1 or 2 visits and not more, and let's say have a budget that they want to spend now on it, get a result, or never really think about it, then this may be a method to choose. I hope this video about surgical hair cloning was helpful.